What I would advise a person that's having symptoms of gastroparesis and you've tried so many products, first of all, I would advise them to get properly diagnosed or what their problem is. If you have not been properly diagnosed, you need to get a specialist, a gastric specialist, to be properly diagnosed. Because if you're on these other medications and you still having the symptoms, that's not the medication for you.
Important safety information. Jamodi metoclopramide nasal spray. What is Jamodi metoclopramide nasal spray? Jamodi is a prescription medicine used 30 minutes before meals and at bedtime for 2 to 8 weeks to relieve symptoms of slow stomach emptying in adults with diabetes. Avoid treatment with metoclopramide, all dosage forms and routes of administration, for longer than 12 weeks. Jamodi is not recommended for use in children under age 18. Important facts about Jamodi. This is a summary of important information you need to know about Jamodi. This information does not take the place of talking with your healthcare professional about your medical condition or your treatment. What is the most important information I should know about Jamodi? Jamodi can cause serious side effects, including tardive dyskinesia, abnormal muscle movements, mostly of the face or tongue muscles. You cannot control these movements, and they may not go away even after stopping Jamodi. Your chances of getting tardive dyskinesia increase the longer you take metoclopramide and the more metoclopramide you take. You should not take Jamodi for more than 8 weeks at a time, and you should not take products containing metoclopramide, including Jamodi, for more than 12 weeks at a time. If you are older, especially if you are an older woman, for example, age 65 years and older, if you have diabetes, call your healthcare professional right away. If you get movements you cannot stop or control, such as lip smacking, chewing, or puckering up your mouth, frowning or scowling, sticking out your tongue, blinking and moving your eyes, shaking of your arms and legs. Do not use Jamodi if you have a history of tardive dyskinesia or have a problem controlling your muscles and movements after taking Jamodi or a medicine that works like Jamodi, have stomach or intestinal problems that could get worse with Jamodi, such as bleeding, blockage, or a tear in the stomach or bowel wall, have a type of tumor that can cause high blood pressure, such as pheochromocytoma, have epilepsy, seizures, are allergic to metoclopramide, stop taking Jamodi right away and get emergency help if you have any of these symptoms. Swelling of your tongue, throat, lips, eyes, or face, trouble swallowing or breathing, skin rash, hives, sores in your mouth, or skin blisters. Before starting Jamodi, tell your healthcare professional about all your medical conditions, especially if you have problems controlling your muscle movements after taking any medicine, Parkinson's disease, pheochromocytoma, kidney or liver disease, depression or mental illness, high blood pressure. Also tell your healthcare professional if you are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed, or drink alcohol. Tell your healthcare professional about all the medicines you take, including prescription drugs and over-the-counter medicines, vitamins, and herbal supplements. Speak with your healthcare professional before you start or stop any other medicines. Especially tell your healthcare professional if you take another medicine that contains metoclopramide, such as Reglan tablets, medicine for Parkinson's disease, blood pressure medicine, medicine for depression, especially monoamine oxidase inhibitor, MAOI, antipsychotic medicine used to treat mental illness such as schizophrenia, insulin, medicines that may make you sleepy such as anxiety medicines, sleep medicines, and narcotics. What should I avoid while taking Jamodi? Do not drink alcohol while taking Jamodi. Jamodi may cause sleepiness or dizziness. Do not drive, operate machinery, or do potentially dangerous activities until you know how Jamodi affects you. What are other possible side effects of Jamodi? Other changes in muscle control and movement, such as uncontrolled spasms of your face and neck muscles, or muscles of your body, arms, and legs, dystonia, Parkinsonism, slight shaking, body stiffness, and trouble moving or keeping your balance, being unable to sit still or feeling that you need to move your hands, feet, or body, akathisia, neuroleptic malignant syndrome, NMS, a very rare but very serious condition. NMS can lead to death and must be treated in a hospital. Depression, thoughts about suicide, and suicide. High blood pressure, too much body water, increased prolactin. Call your healthcare professional and get medical help right away if you feel depressed or have thoughts about hurting or killing yourself, have high fever, stiff muscles, problems thinking, very fast or uneven heartbeat, and or increased sweating, have muscle movements that you cannot stop or control, have muscle movements that are new or unusual. The most common side effects of Jamodi include unpleasant taste after dosing, headache, tiredness. These are not all the possible side effects of Jamodi. Ask your healthcare professional for medical advice about side effects. You may report side effects related to Evoke Pharma products by calling 1-833-4-JAMODI, 1-833-444-6684, or emailing jamodimedinfo@evokepharma.com. If you prefer to report these to the FDA, either visit www.fda.gov/medwatch or call 1-800-FDA-1088. This information should not take the place of you talking with your doctor or healthcare professional. If you have any questions about your condition, or if you would like more information about Jamodi, talk to your doctor or pharmacist. Only you and your healthcare professional can decide if Jamodi is right for you. Please see complete prescribing information, including boxed warning, medication guide, and instructions for use at jamodrx.com.